Well, welcome this afternoon. I'm going to introduce our two panelists here. So Dr. Mark McNemar is Mercy Regional's physician executive. He's the only osteopathic board of orthopedic surgery certified hand surgeon in the Joplin area. He was a founding physician member of Orthopedic Specialists of the Four States in 2010, where he also served as vice president. Dr. McNemar continued to practice and hold that title until the hospital was acquired by Mercy in 2020. Dr. McNemar attended both the University of Health Sciences, KCUMB, and Rockhurst University simultaneously, earning his medical degree and master's in business administration. Dr. McNemar completed an orthopedic surgery residency at St. Luke's Des Perez Hospital in St. Louis, and later completed a fellowship in hand, upper extremity, and microvascular surgery at the University of Texas, San Antonio. He is a member of the American Osteopathic Association, the American Osteopathic Academy of Orthopedics, the American Society for Surgery of the Hand, and the American Academia of Orthopedic Surgeons. He is a native of Columbus, Kansas. All right, Kevin Manning. Mr. Manning is an experienced Chief Nursing Officer with a demonstrated history of working in the hospital and healthcare industry. He is skilled in nursing management, emergency management, with a strong business development professional. Kevin holds a master's degree focused in nursing administration from the University of Texas at Arlington. He has served as Chief Nursing Officer at HCA Healthcare and Director of Emergency Services at Medical Center at Arlington, Texas. He is a fellow of the American College of Healthcare Executives. His interests, the artificial intelligence in healthcare delivery and systems design. Please welcome Dr. McNemar and Kevin Manning.
Thank you for joining us today, and we're just going to have an informal, I think, discussion to start things off, kind of going over some things that are up and coming with healthcare delivery, what that's going to look like in the future. And then towards the end, we'll open it up to the audience for a question and answer session before we conclude our day today. So once again, thank you so much for joining us. And I think that it's so important that we have two very, important to healthcare perspectives on the stage, from a provider standpoint, from a nursing standpoint, and how we can work collaboratively for the better of the patients and their outcomes. So Kevin, I think I'll start off with the nursing perspective, and we'll just kind of go back and forth. And we've already kind of talked about this, but what technologies emerging in future will shape and redefine healthcare for this region?
So definitely, I think integrated healthcare records are going to be a huge portion of this. As we work to address AI and bring those type of technologies, it's important that you've got integrated data to pull from. And so one of the things we're working on right now is in handoff communication is one of the biggest issues of safety in a hospital. And so we're working with Microsoft and Epic to generate an AI generative note from the documentation that will help with that handoff and standardize it.
So when you're talking about an AI-generated note in a medical record, for example, we use SBAR a lot to communicate. That's been a proven way of, giving handoff reports, but summarizing that information so we can be standardized, like you said, when we're handing off important patient information.
Right, and it will use that SBAR format, and really it's going to pull those data points from the charting for the nurse, and really deliver that to a handheld device for the nurses on the inpatient side. And then, being able to standardize, but also customize, because a med-surg nurse may need different information than a pediatric nurse.
Absolutely. What's your take on that?
Yeah, so to build on that, healthcare over the next 10 years is going to be more predictive, more proactive, and more personalized. And To add to your comment on the integrated health EMR, that is an absolute game changer. And to give you an idea of what that means is, with Epic, we've created the single largest instance of health records in the entire country. What we call the 3M triad, which is a combination of Mercy, Mayo Clinic, and Microsoft. We've created a database that is larger than any other database in the entire country to draw results from. And so let me give you an example of what I mean. So if you have an orthopedic surgeon, so I have to kind of go with the orthopedics side of things. So let's say your family member comes in, falls, breaks a hip. Well, they need to be fixed. That needs surgery. And let's say they have a history of some chronic renal insufficiency, so they have some kidney issues, not terrible, but have a little bit of kidney issues. Maybe they have a little bit of heart failure, and that person needs to be NPO, or nothing by mouth, until surgery. So the question is what do you put the IV at? Because if it's 0, then they'll become dehydrated, and the kidney problems will become acute renal failure. If it's too high, you'll overload their heart. It'll progress their heart failure to worse symptoms. And so for the longest time, we've sat here and said, well, we think it's this. Why do we think it's this? Because that's the way I've done it my whole career. There's no data behind it. It's just that's the way I feel about it. With the integrated data streams between Mercy and Mayo, and then utilizing Copilot from Microsoft, we're able to actually analyze all 12 million of these patient records, of these de-identified patient records, and come up with strategies and say, this, from the data that you've supplied on this specific patient, the best course of action is IV rate of 85. And then that will keep that person as healthy as possible, get them out of the hospital as soon as possible, and get them to surgery as soon as possible.
So you see the use of AI like a tool that will only help facilitate the decisions that we make as healthcare providers and nurses and other allied health.
Yeah, right now we call it artificial intelligence, but it won't be long. It'll be augmented intelligence. It's like having your preceptor with you at all times. It's like having that intern who's always looking, or the resident who's always looking up that case study for you while you're actively making decisions in real time.
Yeah, that's awesome.
Yeah, and I think, healthcare, the tools we can use, but it will always remain a human component to it, right? Touch and compassion and really caring. And so I think utilizing it as tools.
Yeah, I think that was brought out with the last session, which was, on AI. That's a big concern I think that the patient population has, is we don't want to lose that relationship building that's so important with caregivers. All right. So what do you see as the most critical need or challenge in this area? So I'll start with you, Doctor.
A workforce. I mean, you hinted on it. This is a people game. The people that are in healthcare are the people that make the difference. They're the people that are saving lives. And no matter how advanced we get with healthcare, the personalization of that matters. And the ability to adopt a workforce that understands not what is here now, but is what is coming, and how to be ready for that when that change comes, and to ingrain in the workforce that is being trained now to adapt to these upcoming platform changes, because there are huge market disruptors that are coming, and we need to be ready for that. And the systems that survive will be the ones that have adopted quickly and efficiently to these new mechanisms.
Absolutely. I think adaptability is going to be critical.
Yeah, and I think as we look at a workforce, we now have 4 generations in the workforce, and we're fixing to have 4 and 5 generations that are receiving care. So I think you have to be adaptable. We're going to have to learn technology, and virtual care, I think, is going to grow and continue to grow, not only at home, but in the hospital as well, and really those physician specialties that are difficult to recruit. I think the other thing is we've got to really adapt and learn to how do we develop people from both graduating high school through a pipeline to get a healthcare career, but then also the nurses that are nurses today, how do we develop them to be the leaders of healthcare tomorrow?
Absolutely, absolutely. So so if you had pie in the sky, in an ideal world, 10 years from now, what would be your aspirational vision for, I think, this greater Joplin area, but even maybe on out into the larger community, out into the rural areas for this area?
Well, I think hospital at home is another good area to really look at. If I'm receiving care, do I have better care at home with my loved ones, or going into a hospital where I may not know anybody, I don't know the surroundings? As we look at certain generations, strangers, and just that whole understanding of how that hospital system works is a challenge. And so I think that's going to be one of the areas, and I think that we'll continue to see wearable technology. As we look at glucose monitoring devices today, are there other devices that can be wearable that you will know instantly what your heart rate is, what your rhythms are? Personally, myself, I've got one of the little EKG cardia things that you can read your EKG at home. So I think those are going to be continued development and sources of.
Absolutely. The Internet of Things, right?
Mm-hmm.
Yeah.
You nailed it. We're going to be doing things in 10 years that are inpatient surgeries or inpatient procedures you would never even imagine that would be done, and then patients would go home. 5 years ago, you would have never imagined that someone would get a total hip replacement and then be home by 3 o'clock. Well, that's happening every single day right now in Joplin, in Galena. That's happening. And that's just going to continue to evolve. And so I want you to imagine in 10 years, when we have these implantable devices, you take the glucose monitoring devices. Now I want you to imagine that gets microscopic, it gets implanted inside you. It is able to monitor it 24/7. You don't have to put your phone up to it. Those phones are going to be obsolete. They're going to have the ability to have augmented intelligence that's going to tell you what your readings were overnight, how you slept, what your heart rate was, what your glucose spiked. Oh, by the way, your glucose spiked a little more than average. Maybe we should get you to go see the doctor before it hits your A1C and starts to affect you chronically. Right now, we have the ability to do a blood draw, spin it down, and read the proteins and identify 50 different, it's called the Grail system, it's 50 different cancers that are in the precancerous stage. It hasn't even become detectable by any other means or ways that we have. And so being able to take that and figure out that, hey, I possibly could have cancer before you know that's even a possibility in the current way that we're doing it is just, it's incredible stuff. And so the other things are the ability to affect pharmacogenetics. You look in staying in the cancer realm. So chemotherapy, right now what do? We say, okay, well, you have breast cancer. So what we're going to do is we're going to give you this regimen of drugs. And the reason why we're giving it to you is because we have all these studies that say that 86% of the time these studies work, or this chemotherapy cocktail works. But when it doesn't work, then we try part 2, and then we try part 3. Well, now we can analyze each individual patient's pharmacogenetics program, and we'll know before that person even gets that first line of chemotherapy whether that is going to work. And so we can go straight to part 2. Or a different cocktail, more effective cocktails. And those are the things that are going to massively change in the next 10 years.
Yes, I think that was touched upon very much this morning about how that's going to change. It is changing right now, as you say, and what effect that will have on looking at health in terms of an upstream viewpoint instead of a downstream viewpoint. So can you speak a little bit towards that? How do we get there? Because I think that's kind of the struggle right now. We need to look more preventative, upstream versus downstream.
Well, I think the glucose monitors are a great example. Years ago, it was large, bulky, and they've kind of shrunk, and now you can use your phone. And they haven't been approved for hospital settings, but I think that's coming in the next year or so. You'll see those devices being used. I think really when you look at giving the patient the autonomy of really owning their results, and it helps them to better track and manage their disease process. I think that's really what it's going to take, is speed to those issues, right? A lot of times it takes us a long time to get from evidence to practice, and I think we've got to speed that up. And I think that's where generative AI and augmented things will help us get there.
Yes.
Yeah, well said. And to build on that, I want you to imagine, so currently with healthcare, okay, so we have limited resources in healthcare. So I want you to imagine a gear shift with 3 levers, and you've got access, and you've got quality, and you have cost. And right now, when you only have limited number of resources that you can use, you have to lever those and just try to get that cocktail just right, where you're saying, am I providing too much access and doing too low a cost, and now the quality is not very good? Or is my quality really high and my access is really good, but now it costs so much no one can afford it? And trying to take that and strategizing around that whole platform over the next 10 years. These things that we're talking about are absolutely true market disruptors that can change that entire equation. So when you talk about the ability to detect chronic illness before it becomes a problem, not only is that access to care because it's 24-hour monitoring, it's also decreasing the cost of the entire system over the lifetime of the system. So
Yeah, I think that hits the nail on the head. I mean, you're talking about disruptive innovation, which is so timely. We're talking about innovation all day today. So, and making those kind of changes that do take time, sometimes social pressure, to feel the patient population feel comfortable with that change. So I greatly appreciate, what you have said. And let's do a couple more questions, and I think we'll open it up for the audience. And so how do you see your role in healthcare and from your perspective right now, in 5 years, and in 10 years? And don't tell me you're going to be retired.
No,
I mean, you can, but.
Yeah, so I sat around for 6 weeks during the pandemic. There's no retirement for me. I'm going to work until it's over. So, but right now we're asking this is from a physician standpoint. So we're asking our physicians to be captain of the ship. And in the future, just because we have limited resources, we'll never have enough doctors in Joplin ever. We just won't. And so we have to use that. I want them to be admiral of the fleet. Okay, so they're the maestro in the chorus, in the chorus and in the orchestra, and they're trying to determine how can we provide wide access to many patients because there's just one physician, and so how can you cascade that through providers through disrupting technologies, things like that. And I think that's what, from a physician standpoint, is that they're going to have to adapt to.
So that's what you see as their role in moving us forward.
Correct, and not only that, but just making sure that the new technologies that are coming out are patient friendly and do meet the needs of the healthcare providers in general.
Yeah. What's your take on that, Kevin?
Well, I think as nurses, we're going to have to continue to be leaders. I think as a chief nursing officer, partnering with academic institutions really to help drive nurses to the bedside, bring in more nurses. What are other ways that we can encourage and motivate people to join the nursing profession? One of the things we're looking at is how we can go out and bring in an unlicensed assisted personnel and have a pipeline, have a way for them to stay with our system and then go through a healthcare profession, whether it's nursing, whether it's radiology, and really us help them pay for it, right? Because that's the biggest thing. Costs continue to go up. It's harder. It costs more to go through a degree program. And so how can we partner with the academic institutions to really help drive and give those openings to other people? I think, nursing has led the way in non-traditional studies as well, right? Online programs, online education. You guys brought in augmented reality, right? And I think continuing to develop those things, I think is where nursing is going to have to be in 5 or 10 years. And how do we continue to partner together to develop our profession?
Yeah, certainly those types of academic practice relationships are so very important. I mean, it can be life-changing for someone like a first-generation student to have such longevity in a career that they love, whether it be a provider or a nurse or allied health. It can truly be life-changing for them and their families, absolutely.
Well, that and changing for the community, right? The community changes when they get those opportunities. So.
Yeah, benefits all of us.
Absolutely.
Yeah, benefits all of us. All right, I think that I'll open the floor up to the questions to the floor. So we have Melinda here. She's gonna look for questions. Any questions from the audience? I'm sorry, I can't see very well.
I think we covered the topic so well, there's no questions.
One question with, and some other speakers have talked about it, with My Mercy being such a big tool in the arsenal, and y'all have sort of referenced this as well. How big is that sort of communication for patients going forward? What's kind of next in that space? How are hospitals, providers, nurses going to use that to communicate better with patients and expectations for patients going forward?
Yeah, so on the My Mercy app, you can do My Mercy messages, and we actually are getting ready to launch the pilot for AI to actually help triage those questions. And so some of that stuff is already in the chart, and so they say, hey, I forgot what time I'm supposed to be at my appointment, or did I get that medicine refilled? That's all in it. The artificial intelligence can take that and can reply for them. And then on top of that, the ability for the AI bot to take that, triage it, and then move it to the provider to actually get more intrinsic answers. And so more clinical based that maybe are not relevant or in the chart, that not relevant, that's not the right word, but just not in the chart.
And I think for, as patients access My Mercy, they see their results. They see their lab studies, their x-rays, sometimes even before their physician does.
Absolutely.
And so I think it draws collaboration, because now they can ask pertinent questions, and really a question that might not have come up had they not had that result.
So increased transparency for sure, yeah.
And coming with a background of emergency services, as we look at patient experience, customer experiences, speed of service is a lot of it, right? And so if they can get their results quicker and have that, it helps that as well.
Yeah, we live in a world where you can pick up our phone and order anything you want. It's at your doorstep, within 24 hours, if not sooner. And, the core root word for hospitality is hospital, and we got to put the hospitality back in the hospital. And so My Mercy is a way to do that.
Mm-hmm. Absolutely. Other questions from the audience? So we have a question here.
Good afternoon, and thank you both for being here. You made the comment just now, we're never going to have enough doctors in Joplin. I just want to expound on that a little bit and ask you a question. We have a medical school. We're producing doctors in our own community. So in your opinion, what is it going to take to retain those physicians that are coming out of the medical school right in our community? And what do you see that the community needs to do, the city, the surrounding area, the region needs to upgrade to make this area more attractive for those who are graduating the medical school to put down roots right here in our community?
Yeah, so I actually, for whatever reason, I actually read today that by 2030, we're going to have 76,000 physicians in a shortage of physicians. And so it's not a Joplin-centric problem that we're not going to have the physicians. It's a U.S. problem, and the actual master of this is Miss Kennedy over there, who has done a phenomenal job working with our medical students. And the important thing is identifying what drives people to certain areas. And for me, I was born and raised here, so was family. So family brought me back here. I was coming back here no matter what. And for my son, who is going to probably go to KCU here in Joplin, I'm going to try to convince him to stay as well. I think he will. But being able to identify those people and find out who really has an interest in doing that and who wants to stay here, who has their own values and ideas on where they want to go, and being able to capture their attention early enough to where we can build those personal relationships, and then to help when they make those decisions and need to make those decisions, be ready to capitalize on that.
I think the other thing, and Dr. McNemar can speak to it probably better than I, is our J1 visa issue in our state. Is really, when we recruit physicians, a lot of times it's a visa issue that keeps us from being able to get them here and locating here. And so talking with the legislature to look at how can we change that system or enhance that system to use different methodology of dividing those up among the states.
Yeah, some great physicians we have lost to the J1 waiver program. So we only get 10. We get 30. It's Conrad 30 is what it's called. But the way Missouri divides it up is 10 per region. And so we're competing with South Kansas City, we're competing with Springfield, we're competing with Joplin, and Bolivar. And so that's only 10 waivers, but HEMONC, MedOnc providers, radiologists, interventional radiologists, we've lost them all to J1 waiver issues. So that'd be a huge bonus for us.
Great question. Do I have any other questions out from the audience? Any questions? Oh, there's a question.
So there's always kind of an inherent bias in humans, right? We always have bias. Do you think that in the next 10 years with the advent of AI, that perhaps working collaboratively, the bias issue in medicine might be decreased, and how do you see that occurring?
Yeah, that's a wonderful, that's a great question. Because who is making the AI, right? They're going to have their own biases, right? And so what's really interesting is that back in September, Kevin and I were both at Microsoft's Copilot unveiling with their DAX program, which is a way to listen in on de-identified information and create notes quickly. And that question on how to take the bias out of the architects making the software is actually something that is #1 on their list. And so, yes, absolutely. The ability to utilize technology to inform you on the things that you're not aware of is something that's at the top of Microsoft's list. And so, yes, I think that will come to fruition.
And I think using the big data, right, is asking the right question, right? If you're looking for, to his example, what's the best IV rate? What is the best IV rate for this population, right? And really getting that specific ask so that you get back something that is specific to this race or this culture, and it's not just a global. So I think the big data and really being able to mine those questions and asking the right questions of that data will help with that.
So framing the question is important, I feel. Yeah, framing the question. Okay.
You both have talked about shortage in staffing, nurses, doctors. If we take that off the table, is there something you're most excited about that you would like to see changed or improved in healthcare in our region?
Yes. So the ability for us to move past the admission culture, so where they get admitted to the hospital for things that they could probably be taken care of at home, which is something that you alluded to, at hospital at home, and being able to stratify that system so that we're not overloading our hospitals when we really need it for critical patients. And utilizing some of the technologies that we have, we're moving in the right direction and we're going to get there. And so I know that kind of builds onto the shortage issue or the capital issues with not having enough beds, but that is, that's something I'm particularly excited about.
Yeah, I would share that. The hospital at home, really opening those beds up to really drive the patients that truly need hospital care versus just some medicine, some IVs, where they can get that at home and still have, just like I said, the wearable technology, us to be able to monitor their vital signs from home and to make changes and tweaks like that so that really, the hospital becomes those that truly need hospital-based care. And I think the other thing I think is just the whole change to AI and data and really how does that really drive better care and better quality for our patients.
I would certainly that a patient would feel most comfortable in their home when recovering from illness or surgery, like you've mentioned. Certainly that probably is the direction that we need to go. And it now appears that we are going to have the tools to do that, right, with the wearable technology and so forth. Yeah. Any other questions from the audience? No? We're good? Okay. Well, I just want to thank you so much for coming and having this good discussion with me and with the audience. And this has been such a, I can't even say wonderful 2 days, of celebrating innovation with yesterday's groundbreaking and today the Innovation Center, and then with the summit today. So we hope that you come back and encourage your staff to come back when we have this in the future. And I believe I'll turn it over to Dr. Van Galen now, and unless there's any other questions out in the audience. All right, very good.
Thank you so much, Dr. Mills.
Well, thank you, and thanks to all of our speakers. I have the privilege of wrapping up the first inaugural Willcoxon Summit. It's been a great couple days here at Missouri Southern with the groundbreaking, with hearing from some really innovative leaders and thinkers from not only our region, from around the country. We're going to do this again in a year. So this is the first year of what will be a series of summits. We'll bring in some exciting speakers again next year. And I think as a university, we are really focusing on innovation, new ways to do things and become better. And so I appreciate all of you for being here. I appreciate the many partners we have in the community in this region. And again, special thanks for the planning committee who did an amazing job at pulling all of this together, hosting our speakers and making everything work behind the scenes as well. So thank you for being here. Have a great weekend, everyone.